Our first question for you is from the audience, and right here in the front row.
Okay, hi.
Hello,
Hi,
my
good
name is
afternoon.
Lynn Davis. I'm on a specialty drug for a significant medical issue. I had been paying $375 for a 3-month supply from an independent pharmacy because my Medicare Advantage plan was too expensive for me to use. That was in April. My pharmacy has been bought out by a larger chain, and now I am receiving services through them. Now the cost for the same drug in a generic form is $600 for a 3-month supply. So my question is, what would you do, or can you explain what you would do to reduce the cost of prescription drugs?
Yeah, right, and I'm sorry that you're having that experience. I'd just like to start with a value, which is I just feel very strongly that you should judge a society based on how it treats its children and its seniors. That is how a society should be judged. And the idea that you would have to pay almost twice as much for this medication is immoral. So I actually, we just unveiled today a proposal that I have in terms of what we need to do to bring down the cost of prescription medication. And it is based on a number of things, including the value that I just stated. It is based on the work that I did as Attorney General for 2 terms in California when I ran the 2nd largest Department of Justice in the United States, second only to the United States Department of Justice, and I took on the pharmaceutical companies. And we won because they were engaged in false advertising and just unfair business practices. So what I'm prepared to do is this, to bring down the cost of medication, one, when elected president, to one, require that the drug companies actually engage in fair pricing. And to do that in a way that is about empowering the Federal Department of Health and Human Services to actually do what other countries around the world do, which is to set fair prices based on benchmarks, based on looking at how they are charging for the same drugs in other countries, based on comparing the rate of the rising of the cost to inflation, and bringing those prices down. Second, I am prepared to basically end the tax break that the pharmaceutical companies have been receiving for advertising prescription medication. You all may remember, it was about in the mid-'80s that the rules changed and they got these phenomenal tax breaks for direct-to-consumer marketing, right? So all of a sudden, remember, we started seeing all these things on TV. And they are making hand over fist in more money. They're putting more money into the advertising. I think it's like 6-fold more. But of course, they're doing that because their main business model is about profit, not about public health. And they're putting more money into the marketing on television because then consumers start demanding it more, right? Which allows them to raise the prices and jack up the prices. So I'm prepared to do that. I am also, when elected, prepared to require that Congress actually pass measures in order for us to fix prices in a way that they are affordable and fair, and to ban the marketing on TV in terms of banning the tax credit for the marketing. But if they do not, I'm also prepared to take executive action. One, to allow consumers, you and all of us, anyone, to actually buy from Canada. To require that they actually have a method of being held accountable by having and appointing an Attorney General of the United States who will be prepared to use the Department of Justice, as I have done as an Attorney General of California, in a way that is about going after the predatory practices of pharmaceutical companies and making sure that there is consequence and accountability when they are engaged in unfair advertising and predatory marketing practices. And to basically make sure that we have basically a consequence if they are engaged in unfair pricing so that we can bring the prices down. And again, that's going to be based on holding them to a standard like in other countries, where there will actually be a fine associated where they will have to pay 100% tax on anything that they are charging above what would be the fair market price for the drug.
Senator. One last question on this topic. What about patent parking? How would you get generics to the market? quicker.
Yeah, so that would be part of the, well, part of the issue in terms of the consequence would be that we could actually, for those that are exceeding the rules, we could actually take their patent. And yeah, and so, and so that's part of how we are approaching it. But the other, and I've actually worked on this when I was Attorney General, because on the patent piece, there is an associated piece, which is the pharmaceutical companies that are attempting to suppress generics. And doing that by attempting, and that's what's happening under this administration. So part of what's happening under the current administration is they're actually feeding the pharmaceutical companies on so many ways, including open to allowing them to extend patents beyond the original duration of the patent. And we have to take into account that what that means is that they're suppressing competition. And when they suppress competition, that means they can keep the prices jacked up because they're the only game in town. And so the patent issue, to your point, is a very big one, and it is directly associated with cost.
Thank you. Senator, you've said that you would do away with, eventually, private insurance under your version for Medicare for All. I'm wondering if that includes Medicare Advantage, which is private insurance that's actually used by 1/3 of Medicare recipients. And what about Medicare Part D, which is the prescription coverage using private providers? Does that part go away under Medicare for All?
So under my vision of Medicare for All, we will not, we will still have supplemental insurance. But essentially there will be a phasing out of the need for private insurance, to be frank, because we will extend the coverage. So for example, vision and dental, hearing aids, which right now are extremely expensive, and those who need them have to come out of pocket for that. So there will eventually not be a need for private insurance because there will be full coverage in terms of most of the services that folks need in terms of access to health care.
The insurance industry is a major employer here in Iowa.
Yeah.
What do you say to those people who's might be looking at your plan and saying, this is going to force me into retirement?
Well, certainly that is not the goal, and that is something that when we talk about transitioning into a new system, there's going to have to be a period of transition. So it would not happen overnight, and there would be an ability then to transition employees into other areas. But certainly I am in the business of making sure that people are employed. It's one of my highest priorities, which is why I have so many other policies that I'd be happy to talk about that are directed at making sure that in our America, people don't have to work more than one job to have a roof over their head and food on the table.
Okay.
This past February, you introduced a bill about Social Security, and it eliminated the cap and also sought to increase benefits.
Yes.
Explain how that would work, especially since we see these reports that the trust fund is going to go kerplunk soon.
Yeah, so first of all, let's also recognize that to have 4 more years of this administration means to really put Social Security in jeopardy. And I will say why. It has certainly been, I think, public and certainly private chatter that this $1 trillion addition to the deficit, that has resulted from the passage of that tax bill that benefits the top 1% and the biggest corporations in this country, is going to have to come from somewhere. And there has been a lot of talk about doing it on the backs of our seniors in terms of cutting Social Security benefits. And as far as I'm concerned, never on my watch will that happen. We made a promise. We made a promise that you work hard, that you pay into this system, and that it would be there for you. And we cannot make it break America's promise to our seniors. In addition, though, to strengthen it, I am supporting an approach that basically says for people making over $250,000 a year, they will actually have to pay into the system the same way people under $125,000 are, so that we can strengthen it. And it's only the right and fair thing to do.
One of the issues that people face as they get older is the need for finding in-home care. People are sometimes turning this into a second full-time job. Would you propose tax breaks to help people who are providing direct care, or is there some other plan that you would have?
So again, if you'll indulge me, I have a long history of working on all of these issues. Back when I was elected district attorney of San Francisco, and I took the office in 2004, during the period of time I was there, I created an elder abuse unit. And actually worked on a lot of not only physical and emotional abuse, but also financial abuse. In fact, it was that early work that I was doing that led me to realize at that time that there was this thing called reverse mortgages that were being marketed to our seniors in a very predatory way. And I ended up going after those practices and actually personally doing training of our seniors on how to avoid falling into the trap. I have worked on issues that relate, the grandparent scheme, where grandparents would be called by a third party, a fraudster, and convinced that the fraudster was a friend of your grandchild, and your grandchild was in need of help, and could you wire some money? I have worked for years on the issue of those, especially around identity fraud, who target our seniors and attempt to take their identity and steal their identity in a way that completely devastates that individual, the victim. On this issue of what we need to do around moving forward, there has to be a focus that understands that our seniors have lived a lifetime of good and productive work. They are sitting on an incredible amount of assets, which include just those things they have acquired over a period of time, much less their homes. And they are primary targets for people who commit fraud. And a large part of my work historically has been to go after that and to make sure there's consequence and accountability, but also in a way that we empower our seniors.
One of the ways to deal with the financial need that drives people to take out reverse mortgages and deal with some of these schemes is the cost of long-term care.
Right.
Do you include long-term care in Medicare for All?
Absolutely. I do include long-term care in Medicare for All. Also, when it comes to what we need to do around long-term care, back to your question about home health care workers, I am supporting actually a bill. I'm sponsoring a bill, co-sponsoring it with a member of the House, that is focused on what we need to do to actually lift up and recognize the value of home health care workers. Because what also happens is that many of them are working 2 and 3 jobs and are not giving consistent care to our seniors, and they develop relationships of trust and familial relationships, and so we need to do more to support the importance of the value they serve. There is the work that we need to do, which I have done, of again, suing long-term health care facilities, residential facilities, that have engaged in abuse. I took on one in California that where they were drugging seniors so that they wouldn't have to deal with them.
Oh, wow.
And so as we have an aging and a growing aging population, there is everything that we need to do around dealing with the pharmaceutical companies and making sure that our seniors, 1 in 5 who have an income of $13,500 a year or less, making sure that those needs that you have, the essential needs, are affordable. It is also about allowing our seniors to live with dignity and respect. It is about getting the services that they need. And then it is also about going after the predators in this space. And I think about all of those because, my mother passed away a few years from cancer. And I went through that process with her. And, when any of us have walked through a hospital at night, and you look in the various rooms to get to the room of your friend or relative, it breaks my heart when I see the number of folks who are in those rooms by themselves. Seniors. And we have to, it goes back to my earliest point, we have to honor and respect and give dignity and give and protect our seniors. And so many are in a vulnerable state, not because they are not strong people and smart people and good people, but because they may have needs that cause them to rely on other human beings. And they should never be in a place that's vulnerable. I feel very strongly about that. The fact that you rely on others should not render you vulnerable. And that's how I think about these issues as much as anything.
Let's circle back to reverse mortgages. You talked about additional education for the consumer.
Yeah.
What do you do to the provider? Do you need tougher laws at the federal level?
Yes, we do. And I mean, I go back to the pharmaceutical companies. Let's just take if you look at the pricing of, there is Humira in England versus the United States. For the same drug, huge difference in price. So our government, the government of the United States, is so much in the pocket of the pharmaceutical companies that we're allowing them to charge our seniors and our people more than other countries are allowing them to charge their people. That's outrageous. It really is outrageous. Because it's not like we have no method of comparison. It's not like we can't compare. We can literally do an apples to apples comparison when we look at then the costs that are associated. So there has to be accountability and consequence. There has to be in terms of, yes, those for-profit long-term living facilities. And there has to be oversight, and that is the responsibility of the government to make sure there is oversight so that people, especially when they are in a state where they're relying and trusting others to have their best interest at heart, that they don't have to fight alone when there is abuse or neglect.
A few years ago, I had to learn this word. It's called spoofing.
Yeah.
How do you address that?
You want to explain what it is?
It's when you pick up your smartphone and you see a number that looks like a local call, 319, and it isn't.
So, first of all, a number of things. Okay, here I go. First of all, really always be suspicious of anyone who is reaching out to you who is a stranger, like other than a family member, a friend, anyone who you don't know. Always be suspicious if they are reaching out to you electronically versus you reaching out to them. Like, just on the natural, be suspicious. If anyone ever wants to talk with you about anything that involves money, or your credit card numbers, or your social security number, or your Medicare number, or your anything that is your personal identifying information, hang up. Tell them to send you something in writing. Do not engage in those conversations, be it through text, email, right? Get them to actually send you something that they mail to you. But just don't trust that a stranger who wants to talk to you about your personal identifying information or about money, just do not trust it. Don't trust it. Don't trust it.
What do you do legally? How do you shut that down?
Well, one is the prevention piece, and then the other is then report it to your local prosecutor. Report it to the AARP. It has, I think, a hotline. I've worked with the AARP for years on public education around some of these issues. But definitely report it to your city attorney's office or your county council or the district attorney's office, the state prosecutor's office, because these are crimes. They're actually crimes. They're financial crimes. They're fraud. And, just to go back to, nothing like the idea that a white-collar criminal has to bring a toothbrush to court scares them. Nothing scares them more than that. The idea that they're going to actually go to jail. So there is that part, which is about reporting, or report to a family member. But the other thing is this, that I'm just going to be candid and say. Often, you may not want to tell a family member that you got caught. Somebody actually just caught you. They caught you, you gave some information you probably shouldn't have, or you trusted somebody you probably shouldn't have. And you may feel embarrassed, and you may not want to tell anyone for fear that, your family thinks that you weren't able to detect it, or God forbid they think you can't, take care of yourself. But don't ever suffer alone. Don't ever suffer alone. Tell somebody you know and trust. But don't hold on to it and not tell somebody, because they count on that. predators count on that. And so, you know, it could be a trusted family member, it could be, you know, the community center or the wherever you worship, but tell somebody.
Senator, I wanted to ask you about another enforcement issue. The Americans with Disabilities Act has been on the books for 29 years. The anniversary is next week. And of course, pioneered by Iowa's former Senator Tom Harkin. Yeah, but there are still significant barriers in public buildings for people with mobility issues. Also, barriers for people who have hearing or sight, vision. Yeah. So, what would you do as president to make sure that the vision of the Americans with Disabilities Act is realized?
Yeah, it has to be upgraded. And actually, I've been actively working with our disability rights community on what that looks like. Tom Harkin did an incredible job, and it's just about building on that in a way that also recognizes the advantages that we have with technology to add to what can be essentially what we need to do to increase accessibility. Because that's what this is. It is truly an accessibility issue. It is about accessibility in terms of sight, in terms of sound, in terms of physical accessibility. There is also the piece that is about what we need to do around you know, requiring the private sector to actually not only deal with the physical piece, but deal with how they are using technology in a way on the vision and the hearing, because the ADA doesn't really address that. Mm-hmm. And again, that's about technology. It's about understanding the resources that are now available to government and the private sector in a way that can increase accessibility. So that's how I think about it.
Are there things that the federal government should be doing to deal with enforcement? Because most of this it's dealt with through civil court, right? But you know, is there more that can be done just to make sure that there are consequences?
Yes, and there is a lot more that can be done because again, this is the job of the federal government, is to concern itself, and government period, to concern itself with public safety, public health, and public education. And on this, it's in particular a public health issue. And so it is about oversight from everything from who's getting government contracts, right? And requiring accountability and compliance for anyone who is a recipient of federal government contracts, of which there are many. It is about federal government buildings and then creating standards around housing, which the federal government does through the Department of Housing. It is the work that we do through the federal government that is about creating standards through HHS. And this is about having an administration that is actually present and focusing on these things. And again, requiring accountability from the private sector, which we've not seen a lot of from this administration.
We haven't much time left on stage here. This is the last question. Accessibility issue regarding broadband. Yeah. It's a social connection for many people. It's a workforce connection for others. Do we need, as a country, a Tennessee Valley-esque effort to build broadband nationwide, and how would you pay for it?
Yeah, so there's no question. And so it is about commerce. You can't run a small business or a medium-sized business. You cannot engage in commerce. You cannot be in the stream if you don't have access to broadband. It's just a reality of 2019. Education. Our kids cannot do their homework without access to broadband and the internet. And you know, here in Iowa, we have so many families and grandfamilies, right? Grandparents who are raising their children, their children's children, because of a variety of issues. And this is something that impacts seniors, the education of children issue, as much as it does anybody. There is the issue of health and access to health for our rural communities. There is where we have, and we still need to do a lot more work around better funding hospitals so they don't have to close down in rural communities, right? Because the funding stream is based on, for the most part, populations walking through the door. But in rural communities, we don't have large populations. The overhead then becomes too expensive, and these hospitals shut down. We need to change the way we're funding them so that those hospitals can stay open. But one option also to make sure in the interim, at the very least, that we get care is telemedicine. Well, you can't conduct or do telemedicine without broadband. And again, so then it's a public health issue, it's about the economy, it's about education. Here's what I'm prepared to do. One, make it a highest priority. Two, do what we need to do to actually diversify, because I actually think that the model is that, but it is not just about underground laying of wires. I actually believe, and what I'm prepared to do is say that we need to put some bidding out there so that it's a combination of satellite technology as well as underground building of wires for broadband, because that's been one of the issues, right? Putting the money into the connection of the wires in areas where there aren't large populations, people have argued, is it worth it? Well, there are cheaper ways to do it for certain communities. So I've actually, as you can tell, put a lot of thought into this, and it is one of the highest priorities because, you know, in places in Iowa and other states around the country where I'm traveling, families are leaving. And again, this is about seniors also. The younger members of the family are leaving because there are no economic opportunities, because there are no opportunities for them to actually engage in commerce or for their kids to have access to what they need to do homework and to be educated. And people don't want to leave home. You know, most people do not want to leave home. Most people want to stay where they've always been and where they went to high school and where they worship and where they, you know, their community is there. And too many families are having to leave, especially the younger families, having to leave rural communities that do not want to. And this is one of the major reasons.
We're a little bit over time now, but if you want to take just a few seconds to wrap up, you certainly may.
I mean, in particular, well, first of all, I want to thank everyone for all that you're doing and for your leadership and AARP's leadership. I just want to go back to the prescription drug piece. I know that there are seniors in Iowa who get on a bus to go to Canada to get your medication, and that's just awful. And when we look at this issue, this is something we can solve. We literally can solve this. But government has to do its job, and leaders have to do their job. I've been in Washington, D.C. in the Senate for 2 years and some months now. And, you know, it sounds like, oh, it's just something people say about the lobbyists and this. On this one, in particular, it's spot on right. There is a business model where people are making a whole lot of money off of selling drugs. And they're not going to give that up easily. And it's going to have to take strong and courageous leadership at the highest levels of our government to transform and to change this. And our neighbor just to the north has figured it out. We don't have to look very far. But we have to have leadership that has the courage to stand up. And I'm prepared to do that. And I've done it before. I've taken them on before. And I've won. And it's just the right thing to do. And then in general, I'll go back to my earlier point. I do believe that we have a promise and should fulfill a promise that we have to those who have come before us. I was raised by a mother who taught us at a very young age that we must honor and respect those who came before us and treat them with dignity and respect. And I feel very strongly that we could do a much better job as a country in taking care of our seniors. And it is not about taking care of you as though you can't take care of yourself. It's about taking care of you in terms of just the moral responsibility that any one of us have to honor those who have come before us and to make sure that they're giving dignity and respect. So there's a lot more work to do, and I look forward to doing it with you. Thank you.
Thank you very much.